Hello, LinkedIn community. Again, my name is Dr. Mike Bummer, and welcome back to a bonus edition of Car Crash Wednesday, which we are today calling MedMal Wednesday, where we're going to look at a standard of care review and opinion on whether or not a surgeon breached standard of care. But before we do that, I'd like to introduce you to my friend and colleague, Dr. Armin Feldman.
Hi, welcome everyone. We're pleased to have you here. And as Mike said, Mike and I were talking and we thought, well, maybe what we'll do today is we'll just veer a little bit away from a car crash case. And there's so many other services that we as medical legal consultants can provide. And Mike actually has a kind of a subspecialty in providing these kinds of opinions. And we thought, why don't we open it up just a little bit and have Mike talk about one of these cases?
Exactly, Armin. I feel like when I've had, onboarding kind of discovery calls with new attorney clients, I like to phrase it that unlike traditional experts, which might have big retainers and kind of be a little bit more difficult to communicate with or really hone down on some of the details of what the attorneys are looking for, we really function like an extension of their team, truly as a medical legal consultant. And henceforth, our rates are also much better usually than most experts. But yeah, I love doing med mal reviews. Obviously, I do a lot of car crash comprehensive medical summary reports, but this got me excited when we had the idea to share a med mal review. So that you okay? Jumping right in.
Right. Yeah, let me just say, it's the attorneys that we work with get excited to know that they have like essentially a PRN physician team member that they can call on when they feel it would be helpful to the case.
Yep. Oh, which I should also pop up. If anyone wants to ask us a question, just pop it in the chat below. If you feel more comfortable sending us an email, I put up comments at physicianshelpingattorneys.com. We would be happy to talk to you about your case, send you some information about pricing, discuss anything. We keep this very simple, and we would love to see how we might be able to help on your cases.
Okay, let's take a look at the case.
All right, here we go. So let's double there. So this case involved a surgeon who was performing a inguinal hernia repair. And this is redacted. These names and people and places are all redacted for privacy. And the attorney had a simple question of us. And again, this was done very quickly. I believe this was done, it turned around in under 7 days from the request.
How many hours did this take you, Mike?
I think it only took me 2.5 hours or 3 hours. Yeah. So very quick, very affordable. And they just wanted to know, because they're not surgeons, they're not doctors, they didn't go through medical training. Was there a deviation in the treatment of this inguinal hernia repair? Because the damage was that this gentleman had a significantly infected Prolene plug and hernia repair, the mesh used. And so kind of just, without getting into too many of the medical details, because every case is so different, but it's important to note for this case, the gentleman was 70 years old. He had a bulge in his groin. He went in for a standard hernia repair, inguinal hernia. During the surgery, the surgeon perforated the colon and then repaired it, performing a side-to-side, end-to-end anastomoses to correct it. And this complication, in my opinion, did not violate or breach standard of care. It's bowel injury is a known complication. But as part of that surgery, the surgeon then went on to place a large Prolene plug into the internal ring of the hernia. About 10 days later, this patient had a fluid collection in the scrotum. And then the day after that, had a huge postoperative wound abscess that did require surgery and had to be incised and drained in the left groin. And that surgical site required removal of the infected mesh.
Yeah.
And showed a grossly contaminated mesh and a grossly contaminated mesh plug. So what I was able to do is sort through, I think there were probably about 600 pages of medical records, sorted through everything. And I was able to discuss this case at a professional level with one of my expert general surgeons. And
So
as
you get a
possible,
curbside consult.
exactly. And Armin, and maybe you even want to elaborate on this, but as in doing this work, me 3 years, you 15 years, we've built up a stable of medical experts who will have very casual, curbside, anonymous conversations with us because we often will send them specialized case reviews that the attorneys need affidavits of merit or testimony and deposition for. So we call them up and say, hey, this case doesn't sound right, or maybe, this is what I'm thinking, standard of care. Am I on the right track? And they'll have a 5 or 10 or 20-minute conversation with us, and we can pass that along in a very fruitful, quick way to save everyone a lot of time and effort and
Right.
energy.
Right. In fact, one of the services that we can offer is to help the attorney find the medical experts that they need if they don't have them at their fingertips.
Exactly. This particular case, kind of wrapping it up, because it's only a 2-page report. Again, this was quick, easy, affordable. The surgeon, I believed, should not have put the Prolene mesh and Prolene plug into a clean, contaminated operative field. And twofold here, the way I supported this opinion for my attorney. One, I found a great peer-reviewed article in the journal Hernia that was titled Use of Polypropylene Mesh in a Contaminated and Dirty Strangulated Hernias, Short-Term Results. This found there was a 26.7% infection rate
Wow.
when Prolene mesh was used in these clean contaminated or contaminated fields. The bowel injury wasn't the issue. It was the use of a foreign body in a field that had been exposed to fecal matter, really.
Right. And there were other techniques that could have been used, right?
That's exactly right. Multiple. And so that kind of is a good segue into the general surgeon that I have. And I have a few, but this one that I called was appalled. I forget the language I used here. I did use the word appalled because I remember his reaction, because the emotional response from experts is often very muted because they don't know that. They don't know all the details. But this surgeon was like, oh, you would never, I would never do that. This is something that people need to, they need to stop doing now. The literature is clear. This is a very poor practice. This is not the way to do a inguinal hernia repair.
Right.
And so he had told me about all these other methods that could have been performed. And so I was able to then compose this very compelling opinion report, let my attorney know that I believe this case was justified to pursue and would be very, worth investing additional resources and time into filing the med mal complaint. And then I offered this last line here. I didn't highlight it, but we then very frequently will help find and vet a well-credentialed medical expert to move the case along, someone who can do an affidavit of merit and be deposed or testify.
Right. So with that, that's an astounding number. 26.7% of the patients will get a wound infection. So just to say it more in plain English, that would be, so to use that kind of mesh would be below the accepted community standard. Would that be fair to say?
Yeah. Yes.
And so the surgeon should have known that and known that there was that risk. And so that's what made it below the community standard of care.
Exactly.
Yeah.
And, we don't have to overcomplicate this today, Armin. This was a very straightforward ask. We handle all types of questions. If you've seen our other Car Crash Wednesdays, I think our last one, we actually just did a causation report where the attorney just needed to know if a pre-existing condition had predisposed to a particular severity of a spine fracture. And we wrote a 2-page report that in fact showed that condition predisposed his client to having a severe spine fracture from a low-speed impact.
Right.
And
so no, I'm sorry, go ahead.
I was just going to say that we feel it as consultants, which again, making that distinction between traditional medical experts is very important because we both have a role. And what's been rewarding is in a much kind of quicker turnaround, more affordable way, we are helping with all of the medical aspects of our attorneys' cases.
Yeah. So in this case, the attorney specifically wanted just an opinion on merit. But oftentimes when we write these reports, not only are we giving our opinion with regard, does it meet or not meet the standard of care, but also we're giving the attorney the preliminary medical education that they need. And in those cases, the reports are often a little longer than a couple of pages because our goal is not only to give the opinion on merit, but also to educate the attorney as to what's going on with the medicine.
And as Armin knows, I would say 3/4 of the time, if not more, our opinions are actually that these medical malpractice cases do not have merit.
Yeah.
When I first started doing this, I'll be honest, I was a bit surprised at how happy my attorneys were to hear that. I kind of had assumed, coming more from a clinical world, that
Mm,
they wanted every case to have merit, and they wanted, because that's, I know it's kind of common sense that that's how they're supporting their business.
mm,
But what I was shocked by is how happy, maybe happy is not the right word, but how satisfied they were to hear a compelling opinion that a case did not have merit.
right.
And they explained that in many different ways. Different attorneys had different languages of telling me that, but
Mm,
some of the ones I remember are, you saved me 3 months and probably 1,000 hours to
right.
just cut to the chase on this, because it was a huge, I remember, as a really serious outcome. But in fact, the medicine was fine.
Right.
So
Well, maybe to just say it in plain English, we understand that our attorney clients, they don't want to carry loser cases with their time and with their money. And so what we found over the years is our attorneys are just as happy to hear when we feel that there isn't a case for whatever the reason. There's a pre-existing condition, maybe in those rare cases where the client is malingering or primarily driven by secondary gain, or there isn't merit in the case. But our clients are just as happy to know that as when we say, yeah, we think you can prove this up doing this and that. So that's been one of the real pleasures for us in doing the work. And I know it helps our attorney clients as well. And the other thing, Mike, is that what my experience also has been, I'm sure it's yours as well, that sometimes the attorney wants us to write a report, even when we don't feel that there's a merit, because they want to give that report to, for example, surviving family members, or even just to put it in their own file. But oftentimes to give to surviving family members to help them to better understand that there really isn't a case.
I'm going to put you on the spot for a second.
Mhm.
I didn't tell you that I was going to ask you this,
Okay.
but the biggest question that I get when I have these discovery calls with new attorney clients about the usefulness of a medical legal consultant on these standard of care analyses
Mhm.
is, if we're not going to use you to testify or write an affidavit, why would I pay you good money to give me the opinion and analysis on standard of care when I could go find a medical expert who could take this all the way through?
Right. Well, first of all, as you said, Mike, 75% of them probably were going to give an opinion that there isn't merit. Also, we can do this a lot more efficiently with a lot less costs. And the other thing is that our opinions are always backed up by evidence from the literature. And if an attorney is eventually going to hire a retained expert, the retained experts relying on exactly the same literature
Yes.
that we'll be relying on to render our opinion. So it's much more efficient, cost effective, and we can usually get the turnaround very quickly and really help the attorney client and really make it so they don't really need to include an expensive expert. And the interesting thing is that by operating so sometimes they'll pay us and they'll have to get an expert anyway, but the fact is that by using us, or the feedback over the years is that by doing it that way, their case is actually more cost effective.
It's funny. I agree, because even when they have us write reports that are, when cases have merit, we write a report, or if we educate them and bring them up to speed, they're now probably down the line, not probably, almost most definitely saving at least 1 or 2 hours of work on that expert's time sheet. And comparing the rates, it kind of becomes a no-brainer as an investment, especially if we save them from pursuing even one case,
Right,
that otherwise would have gone to a $4,000, neurologist retainer or something. We've more than made up for all of that middle ground, and they now have a doctor that they can call anytime. They can email us anytime, and I can't tell you how many times I've answered a quick question and there's no invoice, because we have a working relationship. Again, it's much more like being an extension of the team.
right. Yeah, I think that's well said. Yeah.
So, anything else?
Well, I would just also mention that since we're veering away today from car crashes, I thought it would also be useful for our attorney viewers to know that obviously as medical legal consultants, we work with attorneys on much more than car crashes, right? So we're writing, for example, comprehensive medical summary reports with our medical opinions that attorneys are using as part of settlement demand letters. We can actually physically sit in, observe independent medical exams, right? IME rebuttals. We read tons of reports that answer specific medical questions and cases for most primarily to help the attorney prove up a particular medical theory, sometimes tell them there's no medical theory to prove up, but primarily to help them prove up medical theories. We act as a liaison between attorneys and primarily treating doctors, which reminds me, our attorney clients often share our reports with treating doctors. IME doctors see them. Sometimes judges see them. Sometimes they share them with their clients. So our reports, for the most part, they're certainly not staying behind the scenes. The attorneys use them in a whole variety of ways, but we also can act as very rarely, but occasionally with families, clients, and more commonly with social and governmental and social service agencies, as well as treating doctors. We can do independent medical reviews. We do straight up medical research and provide attorneys with research papers. If the case is going to trial, we can help the attorney in their deposition and trial preparation by preparing questions to ask experts based on our experience and the literature. We do medical case coordination, and I won't go on, but there's a whole variety of other services that we offer as well. And I think you and I both thought, well, let's veer away. We'll do a merit case, but also there are lots of other ways that we can help our attorney clients as well.
Couldn't have said it any better. Well, I think this is a perfect amount of time. I think we got our point across. I'll just remind everyone, if you have any cases that you'd like to discuss, if you have questions, if you need anything, you can email us at comments@physicianshelpingattorneys.com. I'll also mention that we have our podcast. We're back to weekly episodes. That's at physicianshelpingattorneys.com. You can go right to the podcast and listen to it on iTunes, Google Play Store, iHeartRadio, wherever you're listening to podcasts. It's a very casual way that you hear Armin and I talk about a lot of cases, how we're helping our attorneys. And just if you think this could be helpful at all, feel free to reach out to us. We're here.
Great. Yeah, in fact, we just got an email from someone congratulating us on our 10th episode for the podcast. And
excellent.
We've certainly enjoyed doing that there, and there'll be a lot more to come.
Have a great day, everyone.